This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center. I'm going to discuss IV ketamine versus oral and sublingual ketamine and what the difference is and exactly what home-based ketamine therapies are all about. Now, the question is, can oral and sublingual ketamine therapy be more effective than intravenous ketamine? And as we know, there's a lot of home-based ketamine therapy internet options available. People will see these all over the place if they are looking up depression or ketamine. And the question is, how effective is this? And so we know that intravenous ketamine is strongly supported by medical-based evidence for its robustness and its rapid antidepressant effects. We know that a systematic review and meta-analysis of the efficacy of IV ketamine infusion for treatment-resistant depression by Mark Canty and his group basically evaluated from 2009 until 2019 some 28 studies and effectively found a strong and robust effect of ketamine infusions for treatment-resistant depression, and that multiple infusions result in enhanced and prolonged ketamine effect. And that effectively, through Shiroma's work in 2014, that the use of serial ketamine infusions, subanesthetic and dosing, were effective in producing response and remission, which is really important. Remission meaning no depression in treatment-resistant depression, and that also the use of IV ketamine therapy as a repeat dose is safe and effective, and this is shown in a study by Marie Ann Roth in 2010. Now, there are multiple forms of ketamine for administration. We have racemic ketamine, which is what we administer as the IV form, and that's natural ketamine as it's made. It's right and left-handed forms of ketamine in a 50-50 mixture. They're mirror images of each other, and we've discussed this in other videos, exactly what is ketamine. Now, S-ketamine is the left-handed form of ketamine. It's FDA approved in 2019 as Spravato for office use only for treatment-resistant depression. That one is supplied twice a week, initially for 4 weeks, and then weekly thereafter. And it's been shown to be effective in treatment-resistant depression. Now, ketamine given as an IV formulation has 100% bioavailability, and there are numerous randomized controlled trials supporting its efficacy in treatment-resistant depression, bipolar depression, suicidality, among other disorders. And we're not going to go through all the different studies, as we've done some of that in other videos that we've covered. The trials are extensive, and again, there's a lot of consistency in terms of the benefits of IV ketamine. Now, oral ketamine has been a route of treatment that's available, and it has been utilized, and there are several studies available, 3 randomized controlled trials in particular, and it does demonstrate some efficacy in treatment-resistant depression and reducing depression as well as chronic suicidality, but it can take a couple of weeks for it to work. The only problem is it's only 10 to 20% bioavailable, undergoes a lot of first-pass metabolism in the liver, which reduces its bioavailability. It also tastes very poorly. Sublingual ketamine, which is put under the tongue, has a bioavailability of approximately 30%, and this has been more of a rage lately in terms of efficacy and internet-based ketamine programs. And so there's just a number of studies listed below here that kind of reviewed the medical-based evidence behind sublingual ketamine, oral ketamine, transmucosal ketamine, IV ketamine, etc. And again, there's several trials. There aren't any randomized control trials looking at the sublingual form of ketamine that I'm aware of, and effectively these are a lot of them are retrospective reviews or prospective type reviews without controls, but they do demonstrate a certain level of reduction of anxiety and depression that's of significant nature. And so, can home-based therapy treat depression effectively relative to IV ketamine therapy? And so, for mild depression, this can possibly work as a home plan, as an effective treatment plan. There really are no direct comparisons between IV ketamine versus oral or sublingual ketamine directly. And there's, again, like I mentioned, very few randomized controlled trials looking at oral, sublingual, and nasal spray ketamine alone. Now, as far as nasal spray ketamine, racemic ketamine is what I'm referring to as nasal spray ketamine, but Spravato is actually S-ketamine alone, and that one, of course, does have evidence-based medicine behind it, randomized controlled trials demonstrating efficacy in treatment-resistant depression. Now, the goal should be remission of symptoms, remission of the disease process of depression, or at minimum, significant reduction in symptoms. And on the right here, we do see basically another study that was kind of a continuation from the prior slide of Lara and her group that showed that there's antidepressant, mood stabilizing, and pro-cognitive effects of very low dose sublingual ketamine in refractory unipolar and bipolar depression. So, again, there are, trials using sublingual and oral ketamine that demonstrate efficacy in reducing symptoms of depression, treatment-resistant depression, and even bipolar depression. And we have other trials listed here as well, which I'm not going to go through each one individually, but there are ones where they've used intranasal ketamine, looking at a systematic review and meta-analysis, and demonstrated that intranasal ketamine can certainly reduce symptoms. And as far as remission, certainly that is less so when it's just used alone. Subcutaneous ketamine has been used in depression as well, demonstrating that it could be a strategy as well to improve depression. And then, of course, oral ketamine, in which a systematic review and meta-analysis by Nunez's group on the right here demonstrated basically that it is both tolerable and effective for major depression as far as reducing the symptoms of depression, but remission rates were marginal compared to placebo at the endpoint. So getting remission from oral ketamine doesn't seem to be such an effective strategy. So, but we do know that IV formulations of ketamine can certainly produce remission. And that's part of the conversation of this entire video is, that maybe the IV formulation would be effective in causing remission, and then using oral and sublingual strategies to maintain that effect. Now, there is a meta-analysis demonstrating that IV ketamine produces a larger response and remission rates than Spravato, which is the FDA-approved formulation of S-ketamine. And that's the one we just discussed that is used for treatment-resistant depression. So in this study with Bahi and his group, they basically looked at 24 trials as a meta-analysis of 1,877 subjects and demonstrated a significantly larger relative response of IV ketamine to Spravato, and also remission as well relative to Spravato. So basically we see there is actually a head-to-head competition here, head-to-head examination by a meta-analysis of IV ketamine versus intranasal ketamine. So we can see that remission is also a significant target, and IV ketamine has a higher chance of that occurring relative to an intranasal Spravato. So the questions here are, what are your goals? Is it symptom reduction or remission? And are you looking for a therapeutic response or an experience? The reason I mention this is because when you look at a lot of the online packages and deals of internet agencies for ketamine, they'll describe experiences. And, are we looking for like a long-term care plan or a short-sighted opportunity? Is this an experience? I mean, because again, a lot of individuals have already experienced depression. They've suffered tremendously. They've had a long mental health journey. And they're not looking for an experience. They're looking for a treatment. They're looking for a cure. They're looking for remission or significant improvement in quality of life indicators. And so it's important for us to not be short-sighted in our goals when it comes to ketamine therapy or any therapy involving mental health. So the part of the whole process of home-based therapy is the discussion of the inclusion of psychotherapy. And this is also something that is a critical thing to maintain the efficacy of even IV ketamine is continued psychotherapy. Even if you felt it didn't work before, A lot of people can become stuck in therapy. Uh, Therapy can be a lot easier and more significant when the whole process is lubricated with ketamine therapies. And so there are plenty of online ketamine sites that mention that they're providing therapy with their home-based ketamine, and then others, offer the presence of a therapist. Now, this person is, maybe a guide and really not a qualified therapist. And guides are people that just have maybe some knowledge of what it feels like to have that type of treatment, or some other minor amount of really non certified type teaching, but there's actually not a true board certification for being a guide, or some sort of statewide system to determine who can be a guide and who is not. And either way, how much can a session online extract from the complexities of your situation, of your mental health experience with one visit, or even just several visits with several therapists or several guides each time, if you're using ketamine to lubricate a talk session. And basically, virtual therapy during ketamine sessions, whether it's having a drip form or IV form, or just taking the medication by mouth, it certainly can be done. But a lot of patients prefer to have an inward journey, and they don't really want to speak a whole lot. They're kind of just more focused inward. And guides are, what many of the online sites provide, but they physically can't be with you. They're just, available on the internet. And again, they are not therapists. And many online sites for ketamine home-based therapy require that you have somebody with you. And this individual could be a friend or a sitter or whatever. But you have to consider the fact that, you will be a little bit vulnerable at that period of time, especially if you're using a high dose. And so the person that you're sitting with, or sitting with you, hopefully is somebody that you can trust. And many of these guides, are available after the dosing session. And again, while you're at home, you're sitting there with your sitter or family member. The primary thing that many of these sites mention is that you should just journal your thoughts frequently for the therapy, and that the plan for many of these systems is that the journaling is the therapy. And so as you look below here, this comes from one site where they mention that, integration, that after the experience, you'll reflect on your session and refresh your mind. Journaling immediately in your notebook will allow you to solidify and grow on your experience. And this isn't with a therapist, so, there's not really any conversation that's being, sought or affected by that. So that's just, again, another inward journey, but just this kind of superficial presence, maybe, of somebody on the other side of the phone or the internet. Now, integration sessions are best performed after a ketamine session, later that day or in the next couple of days. And that's when your brain is most neuroplastic and flexible. And this construct has been used in many studies. And most ketamine infusion journeys are generally a random flow of thoughts and images, such that even if you set an intention before your infusion experience, you frequently don't experience the intention that you planned. Your brain just kind of goes down its own particular pathway. And so, some people refer to this as the set, that the set can kind of set up the way your mind is when you walk into the treatment is going to be the way that things go. But we do have to recognize that this whole set and setting idea certainly is important, but a lot of it is just being extracted from psilocybin and LSD and prior psychedelics. And again, ketamine is a dissociative agent with some psychedelic properties. Now, there are trance-like states that are altered states of consciousness that certainly ketamine can affect, and it can create. And these types of states are really best enjoyed without interruption from outside conversation. In fact, a lot of times people will have somatic release, and they may even scream out or cry or yell during infusions, for example. And a lot of times that's somatic releasing of really just internal stress and trauma that's being stored in the musculature. And so if we constantly are poking and prodding the individuals during that particular journey, it's actually quite disruptive to the flow. And a lot of times they're even more confused because they're wondering, well, what's going on? Well, why are you checking on me? And what's this disruption? So again, most ketamine journeys are inward journeys, and really what you're trying to achieve is neuroplasticity. You're trying to basically repair neural networks that have been damaged by stress and by trauma. And so, again, guides are not trained therapists. And effectively, I've taken another little snippet here from actually a clinical study that was using home-based therapy. And the results of that particular study, demonstrated from their perspective, from perspective type of a trial where they just give the medication out without a control group and see what happens. They mentioned that they use guides, and they kind of state that they're giving ketamine therapy. But it says here guides are not licensed professionals and do not provide psychotherapy. They do, however, provide an empathetic and warm response to the patient's experience utilizing active listening and reflective techniques. And I'm not really certain, exactly, what direction that goes after the fact. But, when a person's in a vulnerable state, a lot of times it may be difficult for the other person on the other side of that internet connection to, kind of maybe place their experiences and their meanings of life towards the patient. And that could also be misleading as far as the patient's ability to continue healing. So again, a guide is not necessarily an individual who's trained or understands the process of the inner healer that the patient has to go through, and a lot of times they may try to guide the client or patient in a way that is unhelpful. So cognitive behavioral therapy or traditional therapy by trained therapists can certainly extend the results of ketamine therapy. And we're talking about ketamine infusion therapy. And this study by Wilkinson and her colleagues in 2021, basically created a randomized controlled trial in which basically took 42 patients and continued with IV ketamine infusions and basically used cognitive behavioral therapy through this particular construct here on the left to basically affect a long-term outcome of improved mental health. And they actually utilized the cognitive behavioral therapy as well as cognitive assessment tests after ketamine infusions, not at the same time, not in session type cognitive behavioral therapy, but afterwards. So yeah, again, a lot of clients will reach out to us and they'll want somebody to sit there and talk to them during the therapy session. And actually, this particular study, as many others, are utilizing the therapy afterwards, like a day later or 2 days later. And so in this particular case, in week 1, you had 2 ketamine sessions and 2 sessions of cognitive behavioral therapy on other days. And then they repeated it again on week number 2 with then weekly cognitive behavioral therapy in the following weeks. And they did demonstrate that there was improved results and improved maintenance of depression and mood scores, as well as cognitive improvement. And they followed this with cognitive testing. So the construct behind ketamine-assisted psychotherapy is that you have a preparatory session. And basically, you look at the patient and you determine if they're a candidate for treatment. You explore their goals, reflect on their intentions for the sessions. You set expectations and define safety in the process. Obviously, the mindset of the patient is critical to this situation. And of course, CAP therapy was kind of designed, with the psilocybin, MDMA, LSD history. And so, this was kind of just kind of superimposed on ketamine. And so one of the things is that you have to be able to tell patients what ketamine can do for them and what it can't do. So, ketamine therapy and its treatment, will basically improve the mood, but it doesn't change the behavior. So, in other words, if a person is a criminal, there's no medications to treat that criminality. But on the other hand, though, if there's a mood disorder, then, you basically would treat the mood and then address the behaviors that the person had developed over time to deal with that mood and use cognitive behavioral tools to fix those behaviors up once the mood is improved. Now then there's the ketamine dosing session, and ketamine sessions can be performed by a number of routes, but IV is the most effective and most reliable. A session would last about 40 to 45 minutes, and certainly you can have in-session talk type therapies with a psycholytic dose. But a lot of patients, again, like I mentioned, want to have an inward journey, and they don't want to really be interrupted in that flow. And so, again, talk therapy and cognitive behavioral therapy and number of different therapies are typically done the next day or later in the evening, or at a later time, and not in session. But a lot of people reach out thinking that it has to be in session ketamine therapy, ketamine psychotherapy, uh, during the time of the infusion. That's really where they need to be having that therapy session. But that's actually not the case, because most of the psychological flexibility and the malleability of the brain is the next day when the neuroplasticity is increased. And this is where integration comes in. Integration sessions, basically look at the positive outcomes. They look at, they supply support. They integrate insights that the individual may have achieved during the infusions, and then they reinforce concepts of change that are a valuable part of the treatment process. But integration also is important to deal with the difficult ketamine infusion protocols. When somebody gets scared, when they see something they don't like, when they get re-traumatized, or something fearful comes up, basically that's the time to actually look at the session and find out what worked, what didn't work, and how to basically have new learning from a difficult situation. So, again, integration would be something that comes, way after the actual infusion process itself. And then you would repeat this type of process. You go back to the dosing, and then back to integration, back to the dosing. And as we mentioned before, from Wilkinson's study in 2021, they effectively had 2 infusions per week and 2 cognitive behavioral therapy, psychotherapy sessions to follow that each week for 2 weeks. So the psychotherapeutic model for ketamine-assisted psychotherapy is just basically taken from other types of psychedelics. And we're talking like psilocybin, MDMA. And of course, they always mention about emphasis of set and setting in music. We also find lights to be very effective and important, using, again, light therapy as well, which I want to say it's a visual EMDR with ketamine on board, if you want to call it that. But again, there are no studies, working with that at this point. And again, coming into the therapy session or the infusion session with the right frame of mind, where you've taken all the stresses off your plate, and you've kind of gotten your mind relaxed, certainly can be helpful in terms of the outcomes and the way that you feel during the session, but it doesn't absolutely guarantee that you're going to have a calm and relaxing infusion or even a home session. And so, as far as the psychotherapeutic model, it's always important to have a good therapeutic relationship with the therapist, and that's the primary container. And the medication and the physician support the psychotherapy process. So, basically it's the medication supporting the psychotherapeutic process, and the physician is there to also just make certain that, any side effects are taken care of. Now, the therapeutic interaction should not be a one-time session. And integration, is basically what occurred during the treatments, and that should occur over time after the session. So what you want to do is address cognitive distortions of people. Basically, when you get depressed, you start to see the world more negatively. The glass is half empty, and you start to see more negativity, because the deeper side of our brain starts to function whenever we get depressed or when we have mood disorders. And so part of the whole process of getting better is addressing cognitive distortions and fixed beliefs with cognitive behavioral therapy. And that's a little difficult to do when you just have a one-time brief session with a guide or somebody who doesn't really know your situation or the surrounding circumstances of your life on any regular basis. Also recognize that, monitoring is a lot less for home-based therapy. So dosing really shouldn't be as high as a ketamine infusion. You shouldn't expect to get that same result. And if you are, it goes to beg the question of, why would we even bother to monitor patients at all in the office setting if we're giving them an infusion? And there can certainly be problems with ketamine infusions, which would be really anxiety or nausea. Respiratory-wise, blood pressure-wise, and heart rate-wise, pretty much everybody is very stable. But again, nausea can be a problem, and anxiety. So those are things that could be addressed, with the presence of a provider. And the other thing is that, the home-based therapies really should be dosed, a lot lower ultimately, and not really be designed to give the person, a complete out-of-body experience, just for the safety of it all. So, basically, as far as side effects of home-based therapy, and what we see is certainly some nausea and some anxiety occasionally, especially at higher doses. But most of these individuals, from our perspective at Nova Health, are given more or less um, doses that are microdosing of ketamine, and we will work those doses up over time to basically affect the best responses based on a PHQ and GAD-7. But ultimately, we recognize that the IV dosing seems to be a lot more effective in, obtaining remission, and that more or less in terms of maintenance of remission, the home-based therapies provide a better method of maintaining that efficacy of the infusions in between boosters. Now, monitoring of your treatment, as done in the office setting, and done with stable providers, meaning providers like your therapist and your physician, it just can't be matched well with just an internet-based ketamine treatment plan. So, every time you get on there, you're going to see somebody different who doesn't really know you. And, you're, as far as the physician that did your initial intake, they give you a single dose and that's it, boom. And maybe they meet up with you to make an adjustment later on, but it's pretty much, going to be either this dose or that dose. And so those internet providers really don't necessarily even have their own practice or an extensive experience. They're just basically given a cookbook of specific doses. It's either this or it's that, and there's actually no ability to go in between for a lot of them. And so what about complex patients though? And most patients who are treatment resistant or suffering, the ones that are reaching out for this therapy, are complex anyway. By definition, they have pain, they've had trauma, they've had significant adverse childhood events, they've suffered with depression for years and multiple times, they've lost a lot. They also suffer from obesity or eating disorders or addictions and a number of other medical issues, which certainly accrue because of the bidirectional flow of mood disorders and metabolic processes. So they get less from a non-directed approach. They get less from just a simple cookbook approach. And this is a significant number of patients. And we'll kind of refer to the number of dropouts from some of the studies that you'll see for home-based therapies who haven't initially been seen in an office setting or obtained IV infusions with follow-through. So basically, we go back again to some of these, internet plans have presented their ketamine options as experiences. And again, is this supposed to be an experience, or is it a therapeutic intervention? I mean, what are you looking for? Are you just looking for an experience? Well, again, you can go and get experiences with a lot of substances, but you're trying to get a result here, and that's why people reach out to ketamine. It's not an experience; it's actually a treatment. You don't want to just use ketamine as a pick-me-up. You don't want to just say, oh, well, I just feel bad, let me go ahead and pop a ketamine. Because again, that kind of reinforces, certain habitual behaviors that, rather than coping and developing strategies, for improved mental outcomes, you instead lean on a substance, that although it has great neuroplasticity, you're actually, not really getting the connectedness of medication lubricating the therapy process and the improved structured lifestyles that are important for ultimate health. And so what we want to do is we don't want to just cover up symptoms, but we want to hit root causes. And so generally, remission of depression and improved mood is the goal. It's not really an experience, and most people, again, have experienced depression for long enough. And so relief should not just be temporary, although we all want relief from our depressive symptoms. And so a continued treatment approach with frequent goal-directed interventions and dose adjustments really is crucial for better outcomes. I mean, after all, how many times did the doctor just write you one prescription for a dose of a medication and say, well, that's it, that's the only dose that's available? And the reality is that there are a wide range of doses, but a lot of that is based on evidence. And so, again, the basis for some home-based programs is converting sublingual oral dose equivalents into an IV equivalent dosing. Again, using pharmacokinetics and pharmacodynamics, basically taking a look to see, well, how can I make basically an oral program at home and equate that to an IV equivalent dosing? And when we look at IV ketamine therapy, we use 0.5 milligrams per kilogram over 40 minutes, upwards to 1 milligram per kilogram, which has been found to be effective. There is no randomized controlled trial data that show the effective range of sublingual or oral ketamine for depression. And below here is a snippet of Fava and his group in 2020 showing basically dose ranging trials of ketamine to find out what the most effective dose was for treatment-resistant depression using IV ketamine. And we don't have that kind of data available in a large randomized controlled trial or randomized controlled trials for any other formulation. Now, non-ordinary states of consciousness or altered states of consciousness are held as crucial for healing and seen as meaningful. And a lot of this comes from psilocybin and MDMA work, LSD work, but there's plenty of data suggesting you do not have to lose control during ketamine therapy to achieve remission or significant improvement. So dissociation is not associated with outcomes, according to a recent meta-analysis. I list it below here. Here's an example of a study, an observational study, basically 49 patients looked at over a series of infusions. And what they just demonstrated was that dissociation scores were not associated with treatment outcomes of depression. And in fact, in 2020, a meta-analysis review by Carlos Zarate also demonstrated that there was no association of dissociation with antidepressant results. So you don't have to take a huge journey to make ketamine work, but rather it's just the milligrams per kilogram over that specific period of time to affect neuroplasticity. So the journey, although can certainly be helpful for some people, doesn't actually have to occur for most people to get better. And so, of course, there's still a lot of back and forth with this, but I might have to mention that symptom reduction in PTSD is not associated with mystical experiences in MDMA, and this is based on a study here listed with Witten and his colleagues, in which they showed that mystical experiences described by people under the influence of psychedelics are frequently noted to maybe make an effective change in their mood, but the experience with MDMA is not correlated with long-term positive symptom change, which is, of course, related to PTSD work. And the data was listed in this particular paper seen on the right. So even MDMA, the journey is not part of the ultimate treatment outcomes based on even their study. So trying to emulate ketamine infusions in home-based therapy increases the risk of side effects, because what they're trying to say is that you have to have a huge journey. You've got to dissociate. You've got to leave your body and float. And that requires higher doses. And the higher the doses are at home, the more likely you're going to have side effects or some complication. And you can't immediately turn off the voyage once you're in it after you've gotten oral ketamine or if you've gotten IM ketamine, because the way that the body disposes of it takes a lot longer. And so basically, this is why lower doses tend to work better. And home therapies do not work as rapidly as infusions. And they may provide temporary relief, but home therapies do not generally provide remission. And so home therapy is generally best used for maintenance. It's best used to kind of just maintain the efficacy of IV ketamine. And I'm going to refer here to a study using sublingual tablets of ketamine. It's a retrospective study, meaning that they looked at data of people that had already gotten the treatment and then screened them out from there. And so retrospective studies aren't the most powerful studies by any means. And this is not a randomized controlled trial. There's no placebo group. And basically 4,400 people presented to this organization. This is an internet organization for ketamine therapies. And they screened out some 3,300 immediately based on exclusion criteria. And again, we get a lot of clients looking inward to us, and very few of them come in with significant medical problems that would exclude them, immediately. Like liver disease certainly can occur, heart disease and stroke and schizophrenia clearly, and uncontrolled hypertension. Those are obviously issues that would need to be resolved or treated, before you consider any type of ketamine therapy. But generally speaking, even in the ones that are just asking questions about ketamine to us, is probably 1 in 20 patients that has an excluding medical complication, because most people with mood disorders are younger that present for ketamine therapies, usually less than 50 and somewhere in their upper teens. So most of those people are medically healthy. So that said, suicidal ideation is a frequent problem and a complication of mood disorders and depression. So the benefit of the office-based therapies is that all of these things can be looked at, intervened on, and monitored during a treatment process, including blood pressure. The other, issue is that there's a large dropout rate, from this particular study, which is very interesting. So basically, they took 4,400 patients, screened them, and noted that 3,300, were met the exclusion criteria or failed to continue. Maybe they didn't like what they heard. And so they enrolled 1,100 patients and then sent them three ready to dissolve tablets at a specific dosing. And they were, fairly high dosing for somebody who was not used to any type of psychedelic or any type of ketamine type product. And effectively, out of the 1,100, 440, did not actually complete three tablets. And the tablets were basically done, one after the other over the course of a week, I believe. And so that's like a 40% dropout rate, which is really high. And even in the IV ketamine versus Spravato studies, the dropout rate wasn't high like that at all. In fact, IV ketamine has, relatively lower dropout rate simply because you can control the infusions. And so, this might have just been the size of the dose because, again, the whole belief is that you have to have a huge journey to make ketamine work. And of course, that just increases side effects. And then the other issue was that they screened individuals for drug diversion by looking at PMP scores, which, again, a lot of people who have long journeys, long mental health journeys, are on benzodiazepines or gabapentin, or a lot of them have chronic pain. And, they try lots of medications. They have anxiety. They can't sleep. And so there's a lot of controlled substance, including, Ambien, for example, or a benzodiazepine like Ativan or Xanax, and of course, chronic pain. And so, effectively, a high PMP score, certainly you would look at that and say maybe there's a higher ability to divert, but diversion is usually it's an addiction term, and so again, just equating a high PMP score and just really not knowing the individual, is certainly an issue, and that would of course exclude a lot of people with mental health disorders who have trouble sleeping, who have anxiety, and are on medications that are generally all controlled. And so obviously a lot of people will be excluded and considered to be abusers potentially, because again, if you look at this, potential of diversion for abuse was evaluated by psychiatric mental health nurse practitioners, querying state prescription monitoring databases as part of the medical consultation. So a lot of people don't know that when they get controlled substance, and gabapentin and benzodiazepines in particular, and sleeping aids are frequently controlled. And they would potentially be labeled as a person who could abuse or misuse medications. And so, that's a difficult construct. And so, obviously, we take a look at, the individual and look at their history. So you can kind of make a clinical decision about the individual and why they might have received those prescriptions in a good conversation as opposed to just based on a number. And the last thing about this trial is that there was no control group. It wasn't a randomized control trial. And all they showed was reduction of symptoms of depression and anxiety, but not remission. So, again, the problem is that, again, the screening process is difficult. The individuals that are doing your screening don't know you, and they don't get to really meet you in any lengthy process or any recurring process. And then, of course, the real concept is, well, what is the right dose to achieve improvement? And does it have to be high? Does it have to be a journey? Does it have to be psycholytic, or actually does it have to dissociate you to make it work? And if it does at those higher doses, you're going to have more side effects potentially and more people dropping out because they just can't tolerate that type of treatment in a home front. It's just a little bit scary. So, again, although it's still debated, having a mystical experience or losing control is probably unnecessary for better outcomes with ketamine. Now, higher doses lead to more side effects, especially when it's used by an internet protocol. Again, people are like, well, give me more because I don't want to spend as much, on future, internet evaluations. And so sometimes more is less. And we get that a lot. It's like, people be like, well, just give me the most you can because I don't want to have to pay for further infusions. But that actually can be more destructive to the individual. It is based on a specific protocol that is medically validated. Now, if a medical setting, the set where the medical support is available for ketamine dosing is a problem, for a lot of individuals, because a lot of people say, well, the reason I want to do the home-based therapy is because I want to be comfortable at my home. Well, why would you feel more comfortable at home using ultra-high doses of ketamine for your home therapy initially? So if you really think about it, it's like, well, I'm going to give you the same home-based dose that you would get as an IV dose at your home. I would be like, well, obviously in the medical setting, why are they, even doing any monitoring at all there for heart rate or, just side effects in the office? And if I do it at home, what happens? I just have the person that's with me. And then, the other thing is that in the internet protocol, the interaction between the patient and medical provider is one time or maybe twice. It's not continuous, and the treatment's time limited by the package that's purchased. And so they determine your dose, and then you go through your experiences, if you want to call them that, and then maybe meet up with the doctor again to determine maybe a higher dose because you didn't get the results you expected. But is the higher dose necessary? Does that lead to better outcomes? Or maybe more of the same dose is what you need, and people begin to feel that, oh, well, I didn't have as much of a trip, so therefore this medicine must not be working for me. And again, that is a cognitive bias that, again, the trip has to be there in order to make this work. Because really it's all about neuroplasticity, but that happens the day after, when the ketamine is out of your system. In fact, ketamine is out of your system within that hour, hour and a half after you take it. And everything else beyond that is neuroplasticity. That's your inner healer, your brain doing the rest of the work. And you know that as the doses get higher at home, there tends to be more dropouts from the treatment because there's more side effects. And so a steady escalation of the dosing over time may lead to better results. But that's a little bit harder to manage, from an internet protocol, because then they would have to interact with you more and more, and that takes up more resources. And so, again, it's hard for you to pick up the phone and just call the doc's office and say, hey, I got a problem. Instead you have to reach out to them, and, probably just reaching out to an email to basically lodge a complaint, or maybe a help desk, from somebody who's not even located in the United States. But, again, we definitely know results are faster with higher remission and response rates when an IV ketamine protocol is used, and then home-based therapy as a maintenance. That's how we do it at Nova Health. We know that the IV formulation initially worked great, and then home-based therapy as a microdosing or kind of a moderate maintenance therapy. Now, decision-making over the home therapy dosing strategy can frequently be arbitrary. So if somebody just came in and said, I don't want to do the IV, but I want home-based therapy alone, that's kind of arbitrary because, again, you're going to say, well, this dose, of oral ketamine is about, 20% of the IV dose. I should probably give you, 5 times as much of the oral dose to make it equivalent to an IV. But really, the way that it's absorbed in your system and each person metabolizes is going to be a little bit different. And again, we know that the area under the curve changes between each of those dosing strategies. So again, it's difficult to immediately get the best dose, but you want to really start at a safe and lower dose first before you escalate. And if you're basing the dose on an experiential decision, that basically I didn't get much of a trip, and I need to get more. Well, sometimes more is less. And the more you get, the more, side effects and actually the less positive effects you get. So some will consider, the treatment of ketamine as being only associated with altered states of consciousness they experience and not the neuroplasticity. They forget that it's not about the journey, but the journey sounds like so much fun. It's so easy to promote the journey, and people like that. And yeah, I get it. You get some relief during that period of time, but it's really about the neuroplasticity. So those who are truly interested in their mental health will be looking at neuroplasticity. They'll be looking at, well, what comes after this treatment? And how am I going to feel then? Because that's when the ketamine's gone out of your system, and that's when the real healing begins. So no one feels neuroplasticity over the next day. It's not like my brain is popping and I feel some sort of, connections happening. I may feel some sort of happiness and improved mood state, but, again, you can't really sense neuroplasticity. So basically the brief relief from low mood during a dosing ketamine session is really not what you're going to experience when the dose leaves your system over the next couple days. And people will kind of identify that I should always feel the way I feel when I'm being dosed, that every minute of the day should feel just like a ketamine dosing session. And that's part of the cognitive distortions and the fixed thinking that occurs in depression and mood disorders. And that when they start to feel a little bit less, well after the ketamine starts to leave their system, that buzz goes away and that sense of voyage and openness goes away. They feel like there's a failure of the treatment, and they have a difficult time integrating that. And so again, they also have a difficult time integrating the nonlinear improvements that occur. And that, yeah, you may feel better for several hours or a few days, and then you start to feel a little bit worse, but you're better than baseline. But people are less self-aware. They just cannot tell when they've been depressed for a long period of time, how the improvement's going. And that's part of the reason why we use medically validated scoring systems to really address that and see what direction people are going. But again, aftercare therapy with psychotherapy and conversations can certainly address these types of thinking patterns. And it's critical to address basically these cognitive distortions and fixed thinking that occur. And of course, due to depression, we mentioned the cognitive distortions, but we call them cognitive defects. And basically, there's difficulties with self-awareness, about how you feel relative to everybody else. And also with delayed discounting, meaning seeing the value of doing something now for something later, like brushing your teeth, combing your hair, getting out of bed. There's nothing rewarding about doing those things. But you do it because if you brush your teeth, you save your teeth so you can eat a steak 5 years later. But when you're depressed, you lose the ability to sense reward in doing that, because it's really your brain is more fixed on what's going to be rewarding right now versus later. And so one of the things that gets fixed as a person gets less depressed is the ability to see the value in washing your hair and taking a shower and going to work and brushing your teeth. That the delayed discounting is actually improved. And this actually is seen in studies of the brain in individuals as they get less depressed, that there are key midbrain areas that start to function less and you get top-down control, which is, of course, a glutamate-based system as a person gets less depressed. And so these cognitive distortions lead patients to rely on the feeling of the ketamine trip as the actual long-term response that they're supposed to experience, that the feeling of the trip itself is the way that everybody should feel, and it's the way I should always feel, and that if I feel anything less than that, it's not working. And so people will start to seek out immediate rewards and not recognize the long-term successes, because they can happen a little bit slower. Again, it's like taking eye vitamins. You take them every day because 20 years from now you may see better, but I don't see better the next day after I take those eye vitamins. It's a slow process. And so again, there are reward processing errors that occur in mood disorders. And this is part of the therapy that allows people to understand this and really kind of stick with the program, so that just like a modem, as you go through the treatment process, you start to have more lights on your modem light up when the power has gone out. So when your modem has its electricity turned off to it and it starts back up again, certain lights turn on in a certain sequence over time. And that represents different areas of cognitive ability in our brain. And that's the kind of reset that happens. It's not all at once, but rather a steady flow of improvements in a number of parameters in individuals' lives. And so just to reintroduce the whole concept, we can't feel like SpongeBob all the time. We can't just basically see positivity everywhere. As humans, we experience moodiness. That's ups and downs with an emotional homeostatic baseline. That if you're not depressed, you're just at that baseline. You're just kind of there, and you otherwise have moments of excitement, moments of not so excited. But when you're depressed, again, that baseline is totally different. And individuals who improve with depression, will get eventually to a new baseline, but they have to get introduced to that baseline, and then the moodiness that follows. And there has to be, there's certainly issues within a person who has had a significant experience of depression, that certainly continued trauma and stress, such as work or family life or addictions or marriage disputes, can certainly continue to ravage the healing process. And this is not also addressed by most internet offerings. So again, this is where, again, all these other aspects of the individual's life that's not treated by ketamine has to be integrated into a healthier response and better coping mechanisms. So you can't medicate this type of stuff away. And medication is a facilitator to better mental health. It's a treatment, not a cure, for the continued neurodegeneration that's caused by depression and other mood disorders. And in another video, I've discussed that depression is a neurodegenerative disorder. It's associated with cognitive scarring and loss of verbal memory and visuospatial processing and a number of other cognitive constraints. That's where brain fog comes from. And so although relief of basic symptoms is an important goal in ketamine therapies, addressing root causes of depression and mood is critical for long-term success. So you have to improve these other aspects of your life by yourself. That's the inner healer part. You have to address your work. You have to address your marriage and your addictions through further work. So ongoing modifications are needed during the treatment plans. And so a guide or a guide that's supplied on an internet program has no medical expertise or psychotherapy training, and they're not qualified to make further suggestions when there are problems in the treatment process. They can just give you their experience. And again, if you go onto forums such as Reddit or wherever, everybody pretty much has their own success story or their failure story, but that applies to them and not to everybody else. And they don't see the larger picture of thousands of patients that flow through an office setting or any other type of medical setting. Now, you're a therapist, or your regular therapist that you're engaged with and you feel comfortable with, they can provide ongoing continuous care in the healing process. And just like a diet plan, depression and mood disorders result in behavioral changes that require new lifestyle modifications over time. It's hard to produce results in just several sessions. You can't change everything about your life that's kind of changed because of depression. Remember, you have the mood and then you have the behaviors, and the behaviors can become habits. And so after the mood gets better, those habits and behaviors have to change, and that takes time. So remember, the ketamine treatment process is nonlinear, meaning that there's going to be ups and downs, and you have to address the catastrophism of a setback. So the first thing that people think of when they have a little negativity or a lot of negativity is that everything's failing and that the ketamine therapy is failing. So even a mild dip in mood is registered as a catastrophe by an individual who's been suffering for a long period of time of depression. So that's why it's important to continue contact with a qualified healthcare provider, because when you have those episodes, sometimes people can become even suicidal. They can become severely depressed, even though they're better than baseline, because they don't want to go back down to that lower level of functioning and that lower level of poor feelings. And so having constant contact with a consistent care provider is really important. And these setbacks activate the hot cognitive distortions of ruminations and self-failure, sense of failure, fear of side effects, and catastrophic thinking that really goes hand in hand with a lot of mood disorders. So likewise, for all those who continue to get better, continued therapy is important so that you don't suddenly just, quit your job that you hate so much, or divorce your supporting spouse, or make life-altering decisions all of a sudden based on a period of improved mental health. And that likewise you maintain, self-care parameters as well to maintain, your mental health. Because just remember, it's just like your lawn. You don't just mow it and water it once and you're done for the year. It's about continuous care for your lawn. It's the same thing with your hair and anything else in your life. It's about continuity of self-care. So patients need to rely on their inner healer to facilitate continued improvements. You have to have exercise, diet, continued psychotherapy, stress reduction, structured time. One thing that people lose is structured time. They just kind of wake up and they have nothing else to do with the rest of the day. And that leads to boredom, that leads to addictions, and that leads to depression. It's important to socialize with people, get out there and have new experiences. Improve your nutrition, get rid of processed foods and eat more fresh fruits and vegetables, and address addictions, whether it's, actually, internet related stuff, whether it's opiates, whether it's alcohol, whatever it might be. And then work-life balance, as well as integrative health needs. If you're exposed to mold all the time, or if you have food allergies, those types of things certainly should be addressed, as well as Lyme disease. Then there's behavioral activation. It's important to get active. It's important to be active all day long. Exercising, movement of your body is key in improvement of mental health disorders. And engage in hobbies, past interests, new learning. Our brain is hungry to learn new things. It's excited about being challenged with new adventures. And that's one of the thing that makes our brain so awesome is it's always excited about the next great adventure. So the other aspect is returning to nature, because it's all part of a self-care maintenance. We want to get out there, be out in the sun, and be active. And, basically, lack of this type of journal plan allows habitual low mood behaviors to kind of just reinsert themselves, and eventually they derail your recovery. So this is the ongoing care plan that, you would achieve in a more steady state, kind of a encompassing type program that would basically be in constant contact and able to interact with you and somebody that you get to know as well. And this lubricates the healing process. Now, we know that IV ketamine can produce remission in treatment-resistant cases, and it produces it rapidly. But the disadvantages are it requires an IV. It's done in an office, like a medical office, using a controlled substance, and it requires attention to all the basic vital signs because this is kind of the requirements of the medical aspect in the office setting, and especially when it's given as an IV. And certainly some could say the medical environment's uncomfortable, and not all ketamine clinics look like medical offices. The other thing is that this can be expensive and not covered by insurance, but overall costs of home-based therapy ultimately add up to very similar costs, and they don't have as much follow-through. And then, of course, you require a driver to and from the infusions. But the advantage is, is that if there's any crisis management that needs to be done, it can be done quickly from an office setting. Referrals can be made locally because we're right there. We're not, 600 miles away from you on some other, internet-based connection. And we can integrate, the sessions. We can have in-session therapies, and we can also monitor for side effects. The side effects being after the therapy, like insomnia and anxieties that some people feel as they get more behaviorally activated and improve. A lot of people feel more anxious because they're less depressed, but they still have all this energy and they don't know what to do with it. It's a new thing for them to have energy, and they think of it as anxiety. And so those things can be addressed. Now, home-based ketamine therapy options are expensive, and when overall costs are considered, with the minimal psychotherapy support and minimal attention to lifestyle and medical issues that can be addressed by a fully engaged provider, again, IV therapy options mixed with a general broad range of interventions can actually be very effective. And the benefits of IV ketamine is the data is more robust with clear results. There's a significant number of treatment-resistant patients that have fantastic results, and the data is clear with a lot of randomized controlled trials. And basically, we know that there's not only significant response rates based on validated mental health scoring systems, but also remission. And that's the thing you really want. And there's multiple randomized controlled trials demonstrating the efficacy of IV ketamine. And a benefit of the treatment is that the dose is titrated and easily controlled with rapid offset of symptoms when the infusion stops. So if you start feeling nauseated or you get a little anxious, you can just stop the infusion or slow it down. And literally the voyage stops or any feeling stops the moment the infusion stops. And the treatment's monitored as a way that's necessary for any type of vital sign changes, even though there are really minimal vital sign changes with infusions. But again, anxiety, nausea, those types of things are easily intervened upon. And the dosing can certainly be maximized for the individual's particular situation. We know that IV dosing is 100% bioavailable, creates optimal outcomes, and it's validated as well over several trials. And the other thing is that trials of ketamine with IV formulations have been very effective for suicidal ideation, even active suicidal ideation. So office-based initial ketamine infusions and other rapid interventions can treat mental health hurricanes unlike any online-only provider. Severely depressed, suicidal, or bipolar patients with lots of other caveats to their situation, whether it's addiction, obesity, or any other type of integrated problem, can easily be treated in an office setting, but they may be excluded by treatment plans outside the office arena in an internet program. So we know that ketamine has been evaluated for its IV formulations for dose-ranging positive effects. We know that specific doses work best for major depressive disorders based on randomized controlled trials. We don't have this data available from the home-based therapies. And that we can escalate the dose, and that there are specific doses that work better in certain types of situations, such as suicidal ideation, based on this specific trial, for example. And then there's also other situations in which we know that 2 or 3 times per week of ketamine IV therapies work better. This is based on other types of randomized controlled trials, such as this one here with Singh and his group in 2016, for looking at how often we should infuse individuals for their initial series of infusions. And then ketamine can also be used for suicidal ideations, and there's numerous studies demonstrating rapid reduction in suicidal ideation with IV ketamine. And there are very few treatments for this, and most studies and most medications basically reject suicidal patients from their treatments and from their trials simply because they're difficult to treat. IV ketamine has been shown to be rapidly effective for this, but the home-based treatment options alone exclude suicidal patients. And this is what a treatment room looks like at Nova Health in Alexandria, Virginia. It's just a relaxed room, and generally speaking, you're looking forward. There's just a TV set and looks more like a home, more like a kitchen, more like any family room. It could be pretty much anything. But with the lights out and starlights on, effectively, you just see what you see inside your mind. And these are examples of other rooms in our same facility. So again, comfortable, non really medicalized type situations, minus just a small IV. And so if you want to learn more about the entire Nova Health ketamine process, you can certainly look at our other videos, the ketamine therapy overview at Nova Health Recovery, where we discuss why we do what we do and based on medically validated type of research to promote why it's done that particular way. And then the steps for ketamine treatment. Again, step one is to determine if you have a treatable condition. And then step two is to determine if you are medically able to receive the treatment without further medical discussions. And then step three is medical intake and mental health preparation, where we look at your mental health journey, do the medical evaluation, discuss risks, benefits, expectations, what ketamine can and can't do for you, and the follow-up treatment, and discuss the neurobiology of how ketamine works and how it would work for you, and also considerations for additional medical treatments, and address things like addiction, obesity, and pain, and integrate certain treatment options and lifestyle discussions, as well as include appropriate other individuals as referrals, whether you have a therapist or not, whether you want one, during the treatment process. We can certainly engage those individuals immediately and rapidly for people who know about the types of treatments that ketamine is providing for. And then we start the ketamine therapy process, the step 4. And it's done basically 2 to 3 times per week. And there's generally 6 infusions, but sometimes more. And that the individual should have a driver to take them home. And that the dosing strategy starts at 0.5 per kilo, goes upwards to 1 milligram per kilo. We use medically validated scoring systems to assess improvements, whether it's in PTSD, suicidality, depression, anxiety, and then aftercare. Most people will come and get periodic boosters, usually monthly, and they'll go home on home-based oral or nasal spray ketamine for maintenance, with continued integration of ketamine-assisted psychotherapy, lifestyle changes, and constant contact. And individuals, if they have any issues, can easily reach out to us through specific channels. So basically at Nova Health, we evaluate your mental health journey. We can address co-occurring disorders such as addiction, obesity, nutritional deficiencies, pain, integrative medical conditions such as mold intoxication and other types of phenomenon. And we can actually improve outcomes because basically obesity and nutritional deficiencies and pain, they prevent better outcomes. And so you want to maximize those outcomes. And a care plan is generated by Nova Health, and it's modified to your unique needs. One size does not fit all. And we can have CAP sessions where a therapist can sit with you in session or after sessions. And also we can promote integration sessions the day after or several days after each of your therapies. We can modify your current medical and mental health regimen and coordinate with your doctors. And of course, home-based ketamine therapies are offered at microdosing levels as well as higher therapeutic levels based on need and maintenance strategies. But we also offer initial home-based therapy regimens as well. And of course, the IV formulation always works better for getting a person into remission, but for some individuals, the home-based therapy is a direction they prefer to go. And there's also a rapid turnaround time. We have availability rapidly, and so there's constant contact as well. So most people have direct access to me, for example, and our staff, all of whom are aware of how the treatment process goes. We monitor individuals' moods, and we also do cognitive assessment monitoring, looking at medically validated tools to assess and address brain fog. So, treatment goals: remission of depression, behavioral activation and lifestyle changes, improving co-occurring disorders such as obesity, addiction, and pain, improving psychological flexibility with less rigid thinking processes, and improve self-awareness, self-maintenance, and goal setting. It's important to improve your structured time, return to work, and get a better quality of life. Of course, continued psychotherapy is the key to all of this, and recognition that depression is a neurodegenerative disorder and you need continued self-care and self-monitoring, and that home-based strategies of ketamine as maintenance treatment is certainly needed periodically, but you can also use ketamine treatment as a home therapy initially without the infusions, but it can certainly be a lot longer process and not as highly effective. Then there's also the importance of maintaining a longer term vision of what this treatment provides versus using ketamine as just a pick me up with short sighted values. So it's important to recognize that this is something that you would definitely want to go in for basically the cure, the remission. But we also recognize that you have to always have that self maintenance. You always have to be self aware, and you also have to recognize that you probably will need continued treatment, just like your traditional antidepressant that you've taken for years and years, again, to prevent relapse and to promote remission.